Hello and welcome to this webinar. My name is John Fleming and I'm one of the co-chairs of the Hamilton Health Team. I'm joined by my co-chair Bernice King and Paul Johnson, General Manager, Healthy and Safe Communities for the City of Hamilton. We're really excited to take this opportunity to update everyone on the work of the Hamilton Health Team, particularly given the announcement by the provincial government that the Hamilton Health Team is moving forward as one of the first Ontario health teams. Many people in this community have been engaged in creating the application process, and I want to thank them, every last one of them, for that work. We know there is much work to be done to bring these goals to life, and it will require a great deal more engagement from our community in the future. To begin, we'd like to provide some background about Ontario Health Teams. Once fully implemented, every Ontarian will have access to an OHT with the following features: full and coordinated continuum of care for a population within a geographic region, 24/7 access to coordination of care and system navigation services, and work to ensure patients experience seamless transitions throughout their care journey. Measure, report on, and improve performance across a standardized framework, a single, clear accountability framework, funded through an integrated funding envelope, reinvestment into frontline care, and improved access to secure digital tools, including online health records and visual care options. At maturity, Ontario Health Teams will provide seamless, fully coordinated care for patients and will help achieve the quadruple aim. Aim number 1, better patient and caregiver experience. Number 2, better patient and population health outcomes. Number 3, better value and efficiency. And number 4, better provider experience.
Thanks, John. I also want to stress, as part of the Hamilton Health Team story, that this is really a story of how Hamilton has been working together in a collaborative way for many years. In fact, thinking about a stronger integrated health system of health and social service providers has been happening in this community for a number of years. In fact, a group called the Hamilton Community Health Working Group came together in 2016 out of some work that had been happening among anchor institutions in Hamilton. That group had been looking at ways of improving health and well-being to the population of Hamilton and better coordinating services. So really, the move forward to an Ontario Health Team application and our Hamilton Health Team approach has been something that's been in the making in Hamilton for a while. We've had this sense that we need to work better together across a population in order to improve the health and well-being of Hamiltonians. So really, this is about moving forward on things that Hamilton has been doing for quite some time. The vision of the Hamilton Health Team is broader than looking at individual services and how they will just improve their own work. It is about looking at our population as a whole. We do want a healthier Hamilton with lower rates of chronic illness. We want those in our community to be activated, informed, and empowered to navigate health systems and social programs. And most importantly, we want people to be treated equitably.
Thanks, it's Bernice here. Demonstrated by our large primary care provider membership, we have engaged primary care from within our community through a variety of initiatives and will continue to engage primary care and expand membership through to maturity. Between April and September 2019, primary care physicians and providers were engaged through co-design in the development of our Year 1 Hamilton Health Team plan. These individuals also signed on to our Hamilton Health Team application as first wave primary care members and collaborators. First wave primary care collaborators are self-identified from across all primary care models that will continue to support our implementation through to maturity. Many physicians have expressed interest in participating in Year 1 of our development and implementation and have already joined or are anticipated to join in as members or collaborators in Year 1. So far, we have 130 physicians engaged representing more than 200,000 patients. Really grateful for the energy and commitment from primary care providers to help lead this work. We're also really grateful for the patients who have worked with us at every step. The Hamilton Health Team engaged patients, families, and caregivers in a collaborative process to help co-design integrated care models for select populations within our community. Participants have shared lived experiences, personal stories, and caregiver perspectives. Myself and John, two patient advisors, serve as co-chairs of the Hamilton Health Team, ensuring that patients, families, and caregivers were always at the forefront of our work. Hamilton Health Team working group members, including patients and providers, were briefed on select patient engagement frameworks and the Ministry of Health's Patient Declaration of Values to ensure meaningful patient engagement as everyone worked together. There is ongoing evaluation about engagement strategies for patients and caregivers. Their feedback will be used to inform future patient engagement strategies as the Hamilton Health Team continues planning through to the implementation of proposed integrated care models. We appreciate all those who have been involved thus far and look forward to continued collaboration, particularly related to our Year 1 goals. We had representation from more than 20 organizations in submission. 200 plus leaders, community members, patients, and physicians participated in workshops. In addition to direct involvement, we have been engaged with the Hamilton Anchor Institute leadership, known as the HAIL table, the City of Hamilton, Neighborhood Action, Public Health, Social Services, the Indigenous community, the Francophone community, and emergency medical services. We continue to share information through the Hamilton Health Team public website, outreach through webinar presentations, and the local media. We know this is only a start. We look forward to next steps as we focus on our Year 1 goals and priority populations with an equity, diversity, and inclusion lens.
So after hearing a little bit about how we got to our Ontario Health Team application, let's dive a little bit into the work that we see happening over the next few years. The first thing we were asked to do as the Hamilton Health Team in our application was identify priority populations. And while Ontario Health Teams will ultimately be accountable for care across large populations, in these early stages, we were asked to identify places where we would test out some of our new ways of working in a more integrated care model. In Hamilton, we selected 3 priority populations based on the needs of our community. The first is older adults with multiple chronic conditions. The second are children and youth with mental health and addiction concerns, and also adults with mental health and addiction concerns. We felt that that met the community's need, and it was driven by data and some of the things we know about Hamilton that make us a bit different from other communities. We know, for instance, that Hamilton's residents are older and more likely to live in poverty than many Ontario communities. In fact, our population of 65 and older individuals is about a half a percentage point higher than the provincial average, and our senior population is the fastest growing age group in this community. Our low income rates are almost a percentage point higher than those across the rest of the province, and are particularly worrying in terms of our levels of child poverty. We also have one of the largest disparities for avoidable deaths in the province. The reality is that the poorest Hamiltonians are nearly 3 times more likely to die from avoidable causes compared to the richest areas of our community. We know that Hamilton has been gripped by an opioid crisis, and we have the highest rate of fatal opioid overdoses in Southern Ontario. So understanding where we would put our energies from a priority population, we turned our mind to what does an integrated care model look like that can really drive some results. The diagram that you're looking at talks about 2 things. One is the continuum of care, looking at things from a population health perspective. How are we going to raise the health and well-being of the entire population, through to how we can intervene better for those who may be entering into healthcare systems that are very expensive and and don't offer the care that people need. How could we better divert that? And then, of course, we're always worried about those who are high users of healthcare services. How do we shorten the amount of time that they spend in those healthcare services and transition them better to the community? We also looked at what the interventions at those levels and across that continuum of care would look like. And in year one, we will be piloting ways that we can look at improving the outcomes for those patient populations. This may look at, in terms of what we might do, it may include improving transitions into, within, and from hospitals. We know that that kind of transition work will do two things. One is it will lower the amount of people who are spending too long in our hospital system, but it will also expand our opportunities to better support people where they are. Early identification of those who we can intervene with to divert them from healthcare services is also an area where we can make some early strides. And finally, we believe in Hamilton that selecting some geographic clusters where we know place-based care could be delivered would be important to our overall success. Including the Code Red work that has been done in this community over the last decade, it clearly identifies some of the geographical areas in Hamilton where we may want to start. So we dive in a bit to some of the work that we would do around hospital transitions. Here it really is about identifying better and supporting in a better way the folks who could better achieve outcomes through integrated care. Not everybody may be eligible or may need an integrated care approach. And right now, there aren't standardized methods across all of the work that we're doing in health and social care to identify those patients who do require that integrated care. So that work would allow us to invest resources where they can make the most sense. Supporting the seamless transition between sectors. Oftentimes, health and social programs work in tandem to provide good outcomes for people as they move within our healthcare system. And so this will involve us looking at 24/7 access to support and system navigation. We know that often that work doesn't happen just 9 to 5, Monday to Friday. We also need to look at ways that we can better support the unique needs of our population for them to self-manage chronic conditions. How can we deliver programs and invest in services that will help people to better understand their own situation and work through that themselves? We also see a role for technology, and there are some examples in where we can remote monitor patients, and instead of executing resources into the community, we can do that virtually. So we'll be looking at ways that we can better support people as they move in and out of hospitals. But we also want to make sure that we're identifying people early before they get to hospital, and in a perfect world, finding ways that they can avoid at all costs going to hospital for care that could be better delivered in the community. Here we have some examples that we're already working on that we would look to expand. In particular, how we can connect some of our care coordinators in primary care. This is a way that we can work with primary care in a more integrated fashion and provide them with the services and supports that will help them to be successful. We also can see ourselves enhancing and expanding palliative care models and our rapid access addiction medicine approach to care. This allows us to very quickly deal with the populations that may be experiencing mental health and addiction concerns in our community. We know that sometimes we need to look at specific interventions for specific age groups, and for those who are in the early years in our community, this could be looking at the way we work with very young children through some city-led initiatives and some child welfare teams in our community to ensure that we're providing the right care very early on in their experience. We may also look at ways that we can respond postnatally through a collaborative between hospitals and public health to provide the kind of 24/7 support to families that's important. For older adults, this might be wrapping around the very supports that are required to keep people in their homes and ensure that the transition back to home is not one that has a number of gaps in it, but those gaps are filled before that person leaves the hospital. Finally, from a geographic cluster perspective, We have lots to build on in this community. Certainly the work that has happened through our understanding of the disparities across neighborhoods in this community has had us build some good pilot programs that look at how we can wrap around care from a geographic perspective. The reality is, in certain parts of our community, neighbors may live next to each other with chronic conditions, and some may have services wrapped around them and some may not. The question for us is, how can we build services at a geographical level that can provide 24/7 access to coordinated care, provide on-site supports that can help people stay in their home, and also correctly identify the types of services that will support them rather than doing it through emergency medical services and the hospital system. Across our community, we've been able to identify where residents of Hamilton live in areas that may have higher concentrations of chronic illness and disease, and we would be looking at how we could work across social programs and health services to better integrate care in those places. A key deliverable from a provincial perspective and a key for the Hamilton Health Team will be using a digital health model and technology to enable success. We certainly are no strangers to technology in Hamilton, and we think that we can continue to build on the things that we have been doing. In fact, our very data-driven process and understanding what our priority populations look like and how we might better intervene was actually driven by a technology that allowed us to make better solution building models out of the data that we had on individuals. We'd also be looking at expanding things like the OTN's e-visit solution that allows people to have real-time video visits with patients. We could be looking at expanding and integrating MyChart into our Provincial Viewer Clinical Connect. We'd like to see a drive to have more people sign up to use that MyChart system within Clinical Connect. But before we do some of those tactical pieces and expand that, we also want to understand what the barriers are in terms of the uptake to virtual care offerings that, quite frankly, are there in the community today. We believe if we spend some time in our first year understanding what those barriers are, we'll be able to accelerate the number of people who would be looking for ways to use digital health to enable success. One of the questions that we've received as the Hamilton Health Team throughout our application process, and since the announcement of Hamilton as a successful Ontario Health Team, we continue to have asked, is what is the governance of this work? On the screen is a graphic that outlines the layers of decision making that have helped us get to this stage as the Hamilton Health Team. We believe that we can build on this model as we take on more accountabilities and as we involve more people in the work as it moves forward. As you'll see, there are levels of decision making, staff attached to various levels, as well as many community partners attached, particularly at the working group level, where we bring together clusters of individuals and organizations who are best poised to create the solutions that will drive us towards success. At the heart of our governance, however, has always been the Partnership Council, chaired by John and Bernice. This is where the partners get together and talk about where we're going and how we're going to get there. The executive group allows us to move nimbly through some of the decision making that had to be made along the application process, and we know will have to be made as we move forward with our Hamilton Health Team work. The Oversight and Coordination Secretariat is a bit of the glue that helps make sure that while working groups are looking at their own individual foci areas, that we also have an opportunity to see where there are similarities across the working groups. A good example of that, for instance, would be the digital health and the use of technology. Almost every group that we're working with would have some layer of that technology and digital health strategy, and we would want to make sure that we are coordinated and consistent in our efforts across working groups. We often get asked, how can I get involved in the work of the Hamilton Health Team? And I know for some through the application process, they were concerned that they weren't part of the initial work. The answer to that is that we have developed a process and will be encouraging participation and new participation as we build the Hamilton Health Team. We simply had to get an initial group together to make sure that our application could get in on time, and we've done that. Now the question is, who will help us be most successful in achieving our outcomes, not only in year one, but as the Hamilton Health Team moves forward. In terms of successes in year one, we do have some outcome measures that are directly linked to the work that John talked about in terms of the quadruple aim that the ministry has set forward for all Ontario Health Teams. We do in Hamilton want to see a reduction in frequent and avoidable emergency department visits. We do want to see a reduction in the amount of readmission rates within that 30-day period. We do want to see an increase in technology. How can we improve and increase the number of people that are taking advantage of virtual care offerings that we believe better utilize healthcare resources and, quite frankly, allow us to deliver care to more people? And as you've heard about our inclusion and integration that we wish to drive forward on in terms of primary care, we really want to see an increase in the follow-up with primary care providers within that 7-day first week window of transitioning from hospital. So we have some outcome measures in year one that we'll be looking at. Many of these are directly linked to some of the goals and desires of the provincial government, but we really believe in Hamilton this will have a two-pronged outcome. It will have, first and foremost, better outcomes for the patients themselves. But secondly, it will be a better experience for those who are delivering service, who are often frustrated by some of the challenges in moving people between services and coordinating the connections between services in our community.
Thank you, Paul, not only for that excellent overview, but for your leadership and frankly for your profound understanding of this community. In closing, while we have come a long way, we're really just getting started. Much work still to be done, and we look forward to continuing this work to support the people and the provision of care in our region. We look forward to ongoing collaboration with the Ministry of Health, as well as with other partners in our region and across the province. We are committed to continuing to advance engagement with patients and partners as we focus on our year one goals. Please continue to check our webpage regularly for updates and information as this work continues to move forward. And thank you for giving your time today to learn more about our work with the Hamilton Health Team. Thank you.